Start by making a skin incision halfway between the umbilicus and pubis. Incise through the skin and subcutaneous tissue to the linea alba. Rabbits have very little subcutaneous tissue and subcutaneous fat. The linea alba is often apparent just beneath the skin. Bluntly dissect and gently trim away excess subcutaneous tissue to visualize the linea. Once cleared away, grasp the linea alba intent upwards. Ensure no abdominal contents are accidentally grabbed with the linea and body wall. Make a stab incision through the linea alba and carefully extend both cranially and caudally. Again, elevating to avoid accidentally incising through cecum or other abdominal contents. Extending can be done with either a blade and forceps or scissors. In mature female rabbits, the uterus sits ventrally and should be easily apparent. If not, with your fingers, gently move the cecum out of the way and search for the uterus near the bladder. Avoid using a spay hook in rabbits as their intestinal walls are very thin and can easily be torn. Trace one side of the uterine horn back to the ovary. Rabbits do not have a proper ligament like dogs and cats. Avoid traction on the fallopian tubes or oviducts, as these can tear easily. Once the ovary is exteriorized, identify the suspensory ligament. In rabbits, this does not need to be cut. Visualize the ovarian vessels, make a window, and place a clamp encompassing all of them. In obese rabbits and rabbits with excess fat, sometimes you cannot visualize each ovarian vessel separately. Knowing where these are will help when placing the clamp. Place an encircling ligature proximal to the clamp. 3/0 suture size is appropriate for most rabbits. Care should be taken not to trap the cecum and intestines in the ligature or the clamp. Typically, a single ligature is placed and the suture tags are trimmed short. Leaving excess suture material or tissue can lead to adhesions and granulations in rabbits. Place a second clamp distally and incise between the two, ensuring the entire ovary is removed. Release the ovarian pedicle, check for bleeding, and replace it back into the abdomen. Repeat the same procedure for the next side by tracing the uterine horn back to the other ovary. Again, there is no traditional proper ligament, and traction on the fallopian tubes should be avoided. Once the ovary is exteriorized, make a window and place a clamp over the vessels. In obese rabbits, the vessels may not be readily apparent. A single encircling ligature is placed. Again, care should be taken to make sure that no abdominal contents or intestines are trapped within the encircling ligature. After excising, check for bleeding and replace the ovarian pedicle back into the abdomen. Rabbits have robust vessels in their broad ligament. Identify and tie these off separately. Make a window next to the vaginal body, incorporating the broad ligament vessels. Place an encircling ligature proximal to the clamp to tie off the vessels of the broad ligament. Incise, check for bleeding, and replace the stump back into the body. In obese rabbits, fat will often hide the vessels, but a window should still be apparent next to the vaginal body. Rabbits have double cervices. Tie off the uterus proximal to the cervices. A single encircling or transfixing ligature should be placed over the vaginal body. This ligature should be placed just proximally to the cervices. Avoid leaving excessive vaginal body tissue, as this can lead to urine pooling in rabbits. A single encircling or transfixing ligature should be placed over the vaginal body. Avoid leaving excessive tissue tags and suture material to prevent adhesions and granuloma formation. Incise between the clamps, check for bleeding, and replace the stump back into the abdomen. Carefully check the abdomen for bleeding, while avoiding disrupting the tissues within the abdomen as much as possible. This will be a 3-layer closure. The first layer is the body wall. This will be closed in a simple continuous pattern. Partial thickness bites incorporating the external rectus sheath, the holding layer. Avoid full thickness bites to prevent the suture from rubbing on the cecum within the abdomen. Elevate the body wall for each bite to avoid accidental contact with the cecum below. Avoid full thickness bites to prevent the suture from rubbing on the cecum. A continuous Colorado closure will be done. Leave the tag of the knot to the body wall to tie back to later. There is no need to cut the suture at any point during this continuous closure. The next layer is the subcutaneous layer. This is also done in a simple continuous pattern. It is optional to tack down a bite of this to the body wall. This should be considered for long incisions to eliminate dead space. The final layer to close is the skin. An intradermal or subcuticular pattern will be used. External sutures should be avoided as they can encourage self-trauma in some rabbits. After taking the last bite, tie the suture back to the tag from the body wall. Smurf the needle through the skin to help bury the knot. We recommend placing a small green tattoo next to the incision to indicate that this rabbit has been spayed. To do this, incise through the dermis and place a dot of green tattoo ink. Glue can be used to close the spay incision, as well as the small incision created for the tattoo. Thank you for watching our spay and neuter videos. I encourage you to explore our other resources online at houserabbit.org.